So let's talk about the nurses' strike. They've announced the dates for their 2 days of action. Do you support them walking out?
Well, I have to say that today is a very, very sad day because it really indicates that for the first time in its 100-year history, the Royal College of Nursing is now engaging in industrial action. And this is a sign of gross negligence on the part of the Conservative government. The last health secretary who had proper discussions with the RCN was Sajid Javid. We've had 3 health secretaries since then. We know that this was on the agenda for the nurses since the summer. We didn't see meetings taking place with the RCN over the summer. And, I don't blame nurses for saying a situation where they're understaffed, overworked and burnt out isn't acceptable. But this is going to be hugely disruptive for patients. Already so many waiting for treatment. And if Labour were in government, we wouldn't be ignoring the nurses, as Conservatives seem to have done for so long now. We would be sitting down with them. We'd also be sorting out those enormous staffing issues as well. And we would do that by scrapping that non-dom tax loophole and getting the money into the NHS so that we're relieving the pressure.
OK, so you blame the government. You say you don't blame the nurses. So in a word, yes or no, do you support them walking out?
Well, look, no one supports strikes. Strikes indicate that negotiations haven't taken place, that they haven't been serious. This is going to be bad for nurses because they'll be losing a day's pay, obviously, and it's going to have that impact on patients. So it's wrong that nurses have been driven to this stage, and it's wrong that the Conservative government has not been sitting down with those nurses to avert this. Labour right now, if we were in government, would be doing everything that we could to prevent this because we know the impact that it would have. And, when we had Labour governments, we didn't have a single strike in the National Health Service. I think that shows the difference, frankly, between our approach and that of the current Conservative government.
Well, yes, and the nurses are calling for a 19% pay rise. Is that reasonable? Would Labour back that?
Well, it's not reasonable for a politician to sit and pontificate about, 1% up, 1% down. I'm not going to do that. What we would do.
But what about the 19% though, as a figure? It's much higher than other unions are asking for their workers. But do you think that the nurses have a special case? Is 19% reasonable to you?
Well, as I said, I'm not going to pontificate on specific percentages. That's not fair on nurses. It's not fair on patients either. What they need is a proper negotiation. They need government ministers to be sitting down, the other NHS employers, and actually listening to the workforce and finding out what needs to change. I have to say, when I talk with nurses, they are saying that they're overworked, that they're burnt out. Very often it's the lack of other staff that is the big problem. The fact that we're seeing so many nurses leaving. Now, as I said, Labour's set out fully costed plans for getting thousands more nurses back in to our NHS. That's something that we desperately need. That is what we would be focusing on getting a solution to these problems, not on criticising ultimately those nurses who, quite frankly, have been right at the front line during COVID and now with those enormous waiting lists as well.
And the Nurses' Union has acknowledged there will be disruption at a time when the NHS is under strain, of course. Should we view nurses differently from other strikers? There are a number of different unions that are calling strike action in other fields, but it's one thing to have your post delivered a couple of days late, but it's quite another to have an operation postponed or your care potentially compromised in some way. Should we deal with these kind of disputes differently when it comes to healthcare?
Look, all industrial action causes disruption. It causes disruption for those engaging in it because they lose pay, obviously, and then it disrupts the service or the good that's being produced. Of course, that is the case. That's the nature of that action, but it's only ever a last resort. And I think there's a really critical question here. Why are we seeing these types of industrial action now when we did not see them under Labour governments? We saw, for example, when it came to the NHS, that under Labour governments, we had a growing economy. That meant we could deliver fair pay. The context for this industrial action, whether it's in the NHS or elsewhere, is an economy which for the last 12 years has not grown at this level of other countries. We've not seen wages growing either at the level of other countries. And if you look at other nations, they're not seeing these kinds of actions being taken because actually people's pay has been increasing year on year at a far stronger rate than it has been in our country. So this really does show the Conservatives' economic failure, and they need to be getting a grip on this, and they need to be sitting down with those workers, particularly with the nurses, which they've been refusing to do, and get this resolved for the sake of patients and the service.
OK, well, I want to ask you about GPs as well, because we understand today they're planning to lobby the government to have their hours cut to their core hours to 9 to 5. Do you welcome that? Do you back that?
There's clearly a crisis in primary care at the moment, and it's harder and harder for people to get any kind of an appointment at any time. Now, it is again important that the government does actually speak with the representatives of GPs.
OK, but what do you think? Do you think that Sorry to interrupt, Anneliese. I just wonder what you thought, though, about those hours. Do you think that 9 to 5 is more reasonable? There are some concerns about GPs who have families, that the obligation to do evening surgeries it doesn't work for them. What do you think about that?
Well, actually, under Labour governments, we saw an expansion of, for example, drop-in centres, and they provided that easy access for people. You know, many of them have since closed, actually, under Conservative-led governments. We need to make sure we have a system that works for patients and one that works for the workforce as well. And I know that Wes Streeting, who's our Shadow Health Secretary, will be determined to deliver that. You know, he's very, very clear that we cannot accept the situation where our NHS, you know, both primary care, but also acute care, is on its knees, and it has been getting worse, I'm afraid, over the last 10 years. We can't accept that any longer.
A quick word on another of our top stories today, and the news that the government is ruling that sharing so-called down blouse images and pornographic deep fakes will be made crimes. Your reaction to that?
Well, we will look very carefully at this, but certainly we strongly supported measures against so-called upskirting, you know, a similar kind of, you know, appalling act against women and girls. But, you know, this White Ribbon Day, the day when we do focus on bearing down on violence against women and girls, you know, we have to acknowledge that for many women and girls, their life is increasingly unsafe. 97% of sexual offences now that are reported aren't resulting in a charge. You know, Labour set out a number of measures we want to see undertaken. You know, it sounds like government may be looking at an additional measure, as you mentioned, concerning other forms of really unpleasant images taken of women, but they need to be getting a grip on policing on the courts and having a proper register for these kinds of criminals as well who abuse women.